And may it be, Lord, that through this seminar, your name will be glorified. So thank you, Lord, for your love that continues and that never fails us, and the forgiveness of our sins. In Jesus' name we pray. Amen. We would like to welcome this afternoon our first speaker. She is connected with the Department of Health Office. And recently, she has traveled abroad for conferences and seminars in Thailand for health promotion and in the UK for women leading education across the continents and local seminars here in Quezon City and Makati and also Batangas for Matches Development in Multimedia Platform, Health Education and Promotion Officers Summit. I met her last January in our health ministry advisory in Palawan, and she's a very engaging speaker. And her topic is coronavirus disease, COVID-19, the impact and role of the Seventh-day Adventist Church during this pandemic. Let's welcome Dr. Kizia Lorraine Rosario. Dr. Rosario,
Hello, good afternoon.
welcome.
Good afternoon.
Good afternoon.
Can I have my slide, please? So, good afternoon, everyone. I'm very much honored to be with you today. I'm sorry I was not able to be with you this morning as I have a more urgent meeting that I need to attend to. But I'm very much honored to be able to be with you this afternoon. So, the topic that Dr. Lane has given me for me to speak about is uh, how the COVID 19 will impact the church and as well as the Seventh day Adventist. By the way, I'm Casey and I'm currently working now with the National Task Group Against COVID based in uh, uh, Campo Aguinaldo for the national response of COVID-19 in the Philippines. Um, so my perspective is mostly in the national response and basically the Philippines as a country being affected by COVID-19. So we will look at how COVID-19 has affected our country, the Philippines, and also how the church can respond to the needs of the society, and as well as how it has also impacted the church as well. So, next slide, please. So, as you can see, here is the global data. We usually present this daily at the national level for our leaders to have a perspective on where we are when it comes to cases and case fatality rates. And you can see the global data, we're around 7 million, and our case 7.8 million, and our case fatality worldwide is 5.51. So the highest countries affected by the coronavirus disease, COVID-19, is the following: USA, Brazil, and Russia. And when you look at narrowing ourselves to the Asian uh, countries, so India has the highest number of cases, and for Southeast Asia, Singapore has the highest number of cases. And when you try to understand where does Philippines stand in this data statistics, so we contribute 2.32% of the confirmed cases. Um, Back muna, please. And when it comes to total death, we contribute 0.25 of the overall confirmed death. Next slide, please. So when we will try to look at our ranking when it comes to comparing ourselves with the other countries. So when it comes to cases, Philippines stand at 38th when you rank them, and in death 32nd. And in recovery, we have a very poor recording with the recoveries right now, but we're trying to polish all our the data on recovery. So we're 57th, and for testing we are 33rd. Next, please. So this is the epic curve showing multiple countries in Asia. So we have Our highest is Singapore, and next is Indonesia, and Philippines is the third when it comes to Asian countries. Next slide, please. So this is our epic curve for as of June 14. So as of June 14, we have a recorded number of cases of 25,930. Actually, as of yesterday, we already reached 26,000. So as you can see here, you will see that Philippines is still rising as it's rising number of cases and still far off from um, reaching its peak, and Philippines is not on the downward uh, curve of the epic curve. We are not on the deceleration phase. We are actually still in the acceleration phase. However, as you can see here, the NCR is actually going to the deceleration phase, while other regions are increasing in in the number of cases. And when we look at the morbidity weeks, you can see that there was only a slight decrease in the number of cases around April 16 to 22, but then we started to have an increasing number of cases from other regions and region 7. So that is why we recommended that the region 7 um, uh, will be will implement again ECQ, and that was declared just this late night. Next slide, please. Then you can see here the sex and age distribution, and the most of COVID-19 in the Philippines affects the males. No, 14,000 are affected. Males are affected, 56%, and our median age is actually 30 to 39 years of age. Next slide, please. So this is the disaggregation of data by regions. So now, before Central Visayas was not the second. However, actually Davao was the second when you rank the number of cases by regions. However, as of for the second week already, Central Visayas has already been the second when it comes to ranking. However, Northern Mindanao still holds the highest case fatality rate, as well as Bangsamoro or BARM. Next slide, please. When we look at it, here is some more granular data. Can I have my presentation back again?
Pastor Connie, you're sharing. Pastor Connie's Gabo.
Can I have my presentation again?
Slides, please.
Okay. So now we have seen the picture of the Philippines when it comes to COVID-19. Now, as I've said, so now you can see the more granular data with the attack rates for NCR and the Region 7, and as well as the total number of deaths, as well as the case fatality rate. So as I have mentioned before, the highest is Northern Mindanao when it comes to case fatality rate, followed by BARM, and then followed by Ilocos. Yes, Ilocos, and then Western Visayas, and then Davao region, and Calabarzon. So actually, Central Visayas has a very low case fatality rate. Next slide, please. So now we'll try to understand how COVID-19 has impacted our society and our church. And for Seventh-day Adventists, the first thing that really affected us was our inability to mass gather and worship as soon as our countries implemented lockdown measures as well as community quarantine measures. And I think it has greatly affected us as a church when it comes to our worshiping style and our way of, meeting each other as a way of nurturing ourselves and nurturing our spiritual life. Next is when we look at the spectrum of this event, you can see that most of of our problems are actually humanitarian in nature. For now, as you can hear in the news, no, many are displaced, and because of the lockdowns that we have implemented, especially last week, you can hear a lot of returning overseas foreign um, workers coming to the Philippines because of unemployment from other countries. When, as you can see, we have a lot of Filipinos abroad, and when their countries are also in lockdown and are also greatly affected, then our citizens and our fellow countrymen are also greatly affected, and our job as a country is look after them and help them return to the Philippines. And not only that, no, we are not only dealing with the migration of Filipinos from outside the country, but then we are also dealing with individuals being dislocated and displaced from other regions and other places. Now we hear a lot of stories where those from the province are working here in Manila and wants to go back to the province because they are left behind by their employers, and we hear stories of domestic helpers that are being abandoned by their um, employers, and construction workers left behind, no, with nothing to eat because they are also being abandoned by their employers. So there's a lot of stories right now, and that's the effect of this disease, not only of the illness itself, it's but the impact on the society as a whole. Next is, of course, economic loss. As even though Philippines, as they can say, can survive lockdowns until September. However, we cannot negate the fact that most of us are greatly affected, especially those who are self-employed, by the situation in our countries where we are not allowed to really perform our duties and our work. No, so um, if there are no businesses around us and we cannot do these things, then uh, we can feel the economic loss. And I know that and you can hear the news in the radios and televisions that a lot of individuals have already lost their jobs and their means of living because of COVID-19. Next is mental health repercussions. As studies have shown, and World Health Organization actually released a study that says that COVID-19, if you're affected with it and you're infected with the disease, um, it has mental health repercussions. They've seen that more COVID-19 patients are agitated, have anxiety, have signs of depression. And so that's the spectrum of the disease itself. But when you look at the impact also of the overall situation, there's a lot of mental health repercussions when you curtail physical um, um, face-to-face interactions, and you impose physical distancing as well as lockdown and quarantine measures. So we hear stories of people wanting to go to suicide and wanting that are really depressed, and also because it is brought about by the situation, the current situation in which many are do not have their jobs, many lost their family members, many do not have regular income streams, and a lot of things. And of course, lastly, the direct impact of COVID-19 is that when there are increasing number of cases, then it overwhelms the healthcare system. And when it comes to the Philippines, our health system is also very uh, is weak in a sense that when COVID-19 happened, most hospitals also curtailed the number of individuals they admit because they are not willing to go overboard because they might be greatly affected with COVID-19 as well. And that's the impact of COVID-19 when it comes to our healthcare system, in which our hospitals are also not even overwhelmed because they are functioning on a lesser capacity, but the fear of contracting this disease among health workers, and so they also limit the capacity of their hospitals. Yesterday we had a reporting nationwide from or major hospitals all over the country, and we can hear that they have curtailed actually almost one third or a half of their function of their hospital capacity. And like for example, PGH usually functions at around 100% capacity, but now they are only functioning at 40% capacity, like that. No, because it's hard to deal with a new disease, and when you have a healthcare system that is not really prepared to cater these new diseases, no, and then you are easily overwhelmed. So even a few number of patients are already only being reported having COVID-19, then sometimes it even that few number can greatly affect how the healthcare system functions. So this is how we look at things, no? But then, um, next slide, please. But then, our leaders actually has written several articles, no, on how we can deal with pandemics. Or I read an article shared written by the General Conference Department Health, the Health Secretary Department during the time on pandemic and flu pandemic in 1918. So he said that the experiences he wrote the experiences they had before and how the church had tackled that experience and how the church was effective in serving our fellow men and in upholding the church and also in making sure that the members of the church are well attended to, no? So we have examples of this, no. We are not actually we do not we already have a template on how to deal with pandemic, no, and we can look back on that experience and gain perspective on how they've dealt with this pandemic, and also maybe in a sense we apply what they have thought to be effective at the time and then implement it in our current days. As you have seen a while ago, and um i've I've shown you the epic curve of the Philippines. We are not on safe grounds yet. No, we have a long way to go. For that's only for the first wave. No, we are not even through with the first wave. And with the flu pandemic in 1918 actually lasted for around 3 days. No, 3 days, 3 years. So it's around late of 2018 until early of 2023, I think. 1923. So it's around 3 years or more. Like, it's a long pandemic, and we can see that COVID-19 can last this long as well. No? And our experts had not been silent about the possibility of having a second wave. In the 1918 flu pandemic, the second wave was the deadliest. And as our expert would want us to to understand right now is that for us to be prepared for that second wave, and the church must also be prepared for that second wave. Next slide, please. Next slide, please. So what are the lessons that we can get from 1918 flu pandemic? So these are the things that they have implemented during that time. And when you look at how they implemented these activities and these strategies, you can see that it is not far off from how we are actually reacting to the pandemic right now. So firstly, actually, this is from the article that was written by the health secretary during that time. So he said that during the time, Adventist schools experienced closures, and camp meetings and evangelistic meetings were canceled, no, during that time. And churches were closed for periods of up to 2 months. 2 months. No? So I think what happened here is that they closed and they open and they will close again. They open, they will close. So I think the longest time they closed the churches are for 2 months, and I think it coincides with us right now, right? And then the church was organized to help both their members and their neighbors to deal with the pandemic. And the medical system became overly overwhelmed and was unable to cope with the vast number of deaths and sick and the dying. So they actually had um, a system, no, they put in place to address this, and many were left unattended, and there were numerous deaths. So actually, when you look at the 1918 pandemic, is closely reflective of what is happening now um, with COVID-19. Next slide, please. So, W.A. Rubble, the secretary during the time, said that every Seventh-day Adventist church had 10 times as many opportunities for service as he would feel if he had been ready for them. What a chance for missionary endeavor and for practicing the pure religion and under field of which James speak. I think he is talking about James White here. So when you look at this, he is saying that it is uh, necessary for us as Seventh day Adventists to be ready. I will highlight the word ready for us to be able to respond to the pandemic and as well as be able to to grab the opportunities for service during this time. Because when you look at the pandemic, actually, it is a very it is a situation where people are equally seen as human beings. You know, you cannot segregate a person as wealthy, as poor, and it's a leveling off event that highlights all of us, no, as human beings, not only those who are rich or poor. Next slide, please. So when we look at those experiences and we try to link it with our current situation, then we can say, so how can we as Seventh Adventists um, help or have an impact or do something for this current pandemic? And when you look at it, if this will last for a long time, then we must start now in doing something not only for the church, but for the whole society as well. So Pastor Rubble actually um, uh, advised this to happen, no, that every church member must be retooled so that every church member must be able to serve as a lay medical missionary helper and that all members must be knowledgeable about matters of basic health. So that is his advice for the 1918 pandemic. And I think it is still very fit as of now, no? Because as he said, mostly medical doctors, nurses are already filled up with uh, the filled up with the work that they are doing at the hospitals. But we need to serve a lot of people outside of the hospitals that are sick. When you look at COVID-19, actually, around 80% of those are actually mild. And however they are mild, they still needed to be taken care of. That's why the government had put um, treatment facilities, temporary treatment facilities. No? So we must do that. No? We must retool every church member and that they must be knowledgeable about matters of basic health. So next thing that we can do is represent the church in local and national forums. As you can see, for us to have a voice in the larger forums in our society, in our societal forums, it is important that we participate. No, um, I believe here in the Philippines, there's there is a task group, technical working group on religious services that is currently being created, and it was unfortunate actually because I haven't seen a Seventh Day Adventist there, or even a leader of our church that represented us in that forum. Most other religions were actually there, and I was just so busy that I took a glimpse in one of their meetings and I saw that there was no Seventh Day Adventist in that meeting. And I hope our church leaders will be able to be part of those meetings because a religious freedom might have an effect on those meetings. And it is important that we remain represented in those meetings. Next is can I have my presentation, please? Sorry. Next is for every church member of the church, every church member to be active during the pandemic in helping those who are sick. No, we must take active participation, even though we are asked no to do um, to stay at home most of the time, but it does not prevent us to volunteer for all the efforts that is going around the world and around our country when it comes to helping those who are sick. And I and when you look at it, we still need a lot of doctors and nurses um, in our hospitals and in our temporary quarantine facilities and also in our temporary isolation facilities. Like here in the Philippines, like last week we flew, the national task group actually flew to Cebu to ask and look at the situation of Cebu before the president will declare something. And we found there the major feedback of most hospitals is they're lacking in manpower support. So, and they are very much willing to to have volunteers that are willing to serve those who are sick. And for our nurses and our doctors who are staying at home, I think it's a high time for us to serve those who are sick and those who needed our help. And this is a high time really to respond. No? Um, and I think even though it's uncomfortable and it's frightening, um, the Lord will serve us and will will take care of us as He has promised. No? I will share my experience. Actually, I've been responding to COVID-19 since the start of February. Um, yes, February. And until now, I've been reporting daily face-to-face meeting to respond to COVID-19. And at one time, I have been swabbed a lot of times actually because I have been exposed a lot of times as well. And then my mother was always asking me, "Are you positive or not?" And I am just so blessed that the Lord has preserved me for that long, and I'm still negative, even though I've been exposed for um, a lot of times. And I think God will shield us from untoward incidents because He knew that there's still a lot of work to be done um, when it comes to responding to this pandemic and as a church as well. So, the conduct of regular services online. It's very important that we remain and we retain how we conduct our services. And actually, it is important that we still conduct services. However, we'll do it in a different form. We'll do it online. No? I have several calls of different institutions wanting um, to still do face-to-face services. No, especially around April, I receive a lot of calls about our churches wanting to do face-to-face services. But I think uh, I think what this and even the general conference had said that uh, we as Seventh Day Adventists should remain compliant and obedient for the intention of the government to protect ourselves from the transmission of the virus, and that is the intent of Leviticus 13, right? Quarantining ourselves. That's the intent of Leviticus 19. But also, we must be worried about possibility of curtailing our religious freedoms. That's why it is very important for us to be well represented in any forums discussing religious freedom. But for now, because this is a pandemic, it is very necessary for us to also be compliant with the health standards that the government is trying to implement. Because now the intention is to protect us from getting the virus. So it and we are not preventing from worshiping as well, no? And the form of worship lang, no, that we do it online for the time being. Next is what we can do is we can um, temporarily change how we minister and equip the church in doing so. So I've seen how the General Conference had changed their style of ministry. I've seen that they've invited a lot of people to conduct Bible studies online rather than having face-to-face Bible studies, and how the church had been active in giving mental support online, and taking care of our family members, or uh, our church members, and also those who need mental health support outside of our family circles, no. So it's a new way of ministering. Actually, it's a new way of looking at things, and I think now our church is being pushed to thinking differently, and thinking in a way that we can also explore how we do ministry, no. Because to be honest, I've been quite uh, insistent that the church will adapt to how the world is changing. Like before, I was saying that the church should be more active in looking at um, in spreading the good news in digital form rather than on retaining the old way of how we minister. But then I think this event had really pushed us to that limit, and now I'm very happy that we are adapting well, no? Because I believe the church has all have seen the need to serve our members and also other people who need God's word, especially during this time. And for us to utilize this tool, because it's the only tool that we can avail of right now, and for us to utilize this tool, then it makes us adaptable to anything that is currently happening to us. Next slide, please. Yes, this is as I've mentioned a while ago, I've shared stories. We have a lot of locally stranded individuals, those who have without jobs, those who have been abandoned by their employers, and um, we need to, as a church, relieve the suffering of others as God has instructed us to do it, even by just providing them their basic needs. So, what can we do as a church? We have, when you go to your local government units, and even in here in Manila, you can hear stories, no? uh, where they are stationed in one area. Like now, we have a lot of individuals stranded at Villamor Air Base and at NAIA, and those people really need even just their basic needs, no. And yesterday during our national meeting, the DSWD, our social services, was talking about how um, the one reported was very passionate about the government trying really to cope up with the demand to serve these individuals who are stranded and do not have jobs. So they provide food, they provide financial assistance, they provide their basic necessities, and they provide everything. But they said we cannot do this alone. We need other members of the society to support us, the private sector, and we need to mobilize our church to address these needs. No, and I know that the locally stranded individuals are not only seen here in the national capital region. Actually, it is being seen in most of our regions, in our localities. No, there's a lot of individuals stranded. And what we can do in our small ways is look for those stranded individuals and try to help them. Now, with the government trying to loosen up the quarantine measures, we can see that we can start mobilizing as well. So, and we are allowed, and actually, you are still allowed to move as long as you ask permission that you are providing basic needs for our fellow men, then you will be allowed to move around even though you are in ECQ or modified ECQ. Next is we can provide mental support to others, and this is a thing that we need a lot of help. No, the government actually need a lot of help when it comes to this, because there are very few uh, mental health experts or psychiatrists and our psychologists. And what we do now is we have online services, like they call us uh, every now and then, no, if they feel something, if they are depressed, if they uh, need encouragement, if they need support. And sometimes if they are suicidal, actually they call our hotlines. And sometimes I'm being linked also to those hotlines, and they will come, can you answer this patient, or this individual? She's asking for encouragement right now. And of course, sometimes it's very hard when you are also responding to a lot of things, including this. And we can our church can allot uh, certain members of our church to be part of this network, and for them to share words of encouragement, Bible verses, and other things for these individuals. No, we can form linkages actually and networks for these psychiatric and also psychologic networks. Na we can link our members to this church, to these networks, and these networks will also link us to individuals who are in need of help. So next is I think for the last part is support our the efforts of our government, whichever government you're under in. So like for example now we need help in contact tracing, we need help in manning our temporary treatment and monitoring facilities, and uh, um, for most part we need also just to follow the basic minimum health standards. No, and as a church I would want to encourage that for us to participate, no, and to be active advocates of what our our government is saying, because as much as possible we want this to end. And I'm very thankful that other ASEAN countries have already ended, like I know Thailand has had no new cases for a few days already, or for a few weeks already. And other countries like Taiwan has declared that they have already beaten coronavirus, and we have these examples within our uh, region. However, for the Philippines, as I said, we still have a long way to go, and we need the help of everybody to participate if we want this really to end, and if we want um, for our regular um, activities to be returned, and how we deal with things before. No? So those are the things that I think is necessary for us to do right now. Even just obeying the basic principles of public health, and also basic principles of health as well. So next slide, please. I think that's all. Thank you. My last words will be that may the Lord give us the spirit of wisdom to know and what to do and when to speak, and the spirit of loving courage to do so, and the zeal to pursue the divine mission of the church during these challenging times. Hopefully, we can work together as a church and to help those who are greatly in need, and for us to respond to the needs of our society, especially during this pandemic. This pandemic has really changed the way how we see things, and I think God is teaching us also a lot of lessons, and I think this pandemic is not actually a bad thing that is happening to us. It's it is actually a blessing for all of us, for us to reflect more on what must more on spiritual things, and not just go about life without an aim or purpose. And I think with that, no, we can learn a lot of lessons when it comes to dealing with this kind of events, and also for allowing us to be closer to our Heavenly Father during this time. Thank you very much.
Thank you, Dr. Rosario. That was really very relevant and significant. I think the Adventist Church has to be more active when it comes to the proposal of having the church as a center of influence, especially during these times where our services are also needed by the government.
Yes.
So, thank you so much, Dr. Rosario, and I think Asia will present the certificate of appreciation.
Answer
Or Dr. Lane.
question first, Doc.
Oh, question. Okay, any questions from our viewers?
So, do,
Okay.
can I ask questions right now because I'm leaving the group after this? So if you have any questions you want to ask me, let me know so that I can answer it right now.
Okay.
Dr. Rosario, good afternoon.
Yes,
Dr. Rosario, can you hear me?
yes, very
Thank
well.
you. From the Adventist Medical Center, Iligan, what do you suggest or what can you recommend to our SDA doctors as frontliners, including also our nurses, to be the program that could help also our frontliners in Adventist hospitals? Thank you.
I don't know much about the situation in Iligan. Do you have a lot of cases there?
Um, less
Not,
than
yeah, less, right? Uh, I do not know if now if your doctors and nurses are actively participating in the COVID response. Are they participating?
Yes, we have actually our triage. We have implemented the infection control guidelines. And I am asking of possible recommendations that you could suggest to also address the needs of all frontliners in all SDA hospitals.
Hmm. Um, I do not have a clear picture of each hospital, but I think what we can do is we can look at the capacities of each of our hospitals and look at where the needs are so that we can allocate resources. I hope there's a centralized system in the Seventh-day Adventist Church that look at all these hospitals so that we can respond to, like, for example, if this hospital is greatly in need of manpower resources, then we can help them and designate individuals from our other hospitals to be designated there for a while to help them with the response. And because when you look at COVID-19, actually it's a disease that sprouts in different parts of the country at not at one time, at different times, because when we did a community quarantine, so we have curtailed the COVID-19 mostly now in NCR for a few months. For the intent there was really to allow other regions to be ready, you know, to be ready with their capacity, and also for them to really prepare themselves for the possibility of transmission of the disease in their own regions. And now actually, because we're opening up NCR, then we can see a increasing number of cases in other regions as well, and I believe so in the following days then we'll see other regions reporting more number of cases. So like for example, now we have Cebu, and actually now we're monitoring region 8 because we have seen a surge there just last June 13, in the number of cases now. So we're monitoring region 8 and region 7 right now. So most possibly other regions will have an report in will have an increase in the number of cases. I think we're slowly seeing an increase also of the northern regions, no? In Luzon, we're seeing a region 1, region 2, we're seeing a slow increase in numbers. So if we have institutions there, we'll make sure that there's a centralized team in
Yeah,
our conferences that look at this so that um, we can address their needs as soon as possible. No, I hope someone has to look after that. No? When it comes to the government system, and as well as actually the national government is looking at that. No, like for example, in Cebu, what we look at is we look at the capacities of each of the hospitals. Actually, we've seen that Miller Hospital, how Miller Hospital is faring as well, including Chongwa, Perpetual Sucor, Cebu Doctors, how they are currently performing right now. So a recommendation was to send additional nurses to these facilities, nurses and actually doctors to these facilities because they're experiencing a surge. For our for our own hospitals, the Seventh-day Adventists can do this as well for us to be prepared for any surge and to capacitate our hospitals and prepare them for surge capacities.
Dr. Keisha,
Yes,
this is Luis Murillo from Santa Rosa City, Laguna,
yes,
and
sir.
I am a literature evangelist. And most probably, the most affected of our workers are
Yeah.
the literature evangelists because we
Yeah.
cannot go around. And you mentioned a while ago that we can ask the government for some permit. I just would like to ask, how can we go about that? Because I tried and but I tried a different thing to ask permission with, because I tried to tell them that hydrotherapy could be a very good way of fighting COVID-19. But somehow they were so busy with whatever they're doing already, and so they can't give me attention. But my concern is, how can we go about asking for permission that our literature evangelists can go around and do house to house selling?
I think, sir, for selling purposes, that is not allowed right now, as you have as you have known, because the intent is that as much as possible we limit the exposure of individuals to COVID-19. So for the purpose of selling, most likely you will not be permitted, no, for your safety. However, if you stay, that's why the World Church, even in 1918, advised that our members of the church should be retooled and should be trained when it comes to medical missionary work, because that is the only way you'll be allowed to be a frontliner and to work.
Yeah. So,
And if you want to sell, I'm sorry, but I think if you want to sell, that would be very hard. But then if you want to serve as a frontliner and serve those who are sick, then you will be allowed.
Dr. Kajia,
by being a frontliner, what do you mean by that? How can we retool our literature evangelists to be frontliners? Is that possible?
Yes, that's possible. I believe if the church can train our members when it comes to basic health and basic services,
আচ্ছা লাবণী মারান্ডি নামাইছে আমার
and we
ছবি
can and if we can help our
দেখেন
local
লাবণী মারান্ডি
governments and say that we can serve your, like for example, temporary quarantine facilities where the mild cases are being housed, or our isolation facilities, and if we say we can help in those areas, and if you want to apply hydrotherapy and you want to talk to these individuals, you can do so. And we need volunteers for that. There's a great need for those kinds of services. So maybe then if we know those individuals in the long run, we can start selling them our books and also sharing the good news.
Yeah.
Dr. Kajia, may I have a question?
Yes.
I am
Yes.
from Bangladesh.
Yes, sir.
I am so thankful. We are so thankful for your presentation. During
Thank
your session, you recommended some of the points, but as a mission leader, I would like to say that we do not have that hospital and other thing that we can take care of the sick person. But as you mentioned that as a worker, every church member should be the health missionary, right? So as a worker, as a mission evangelist and teacher, how can we, what are the procedures that we can do as a missionary, health missionary worker for God? So would you please give some suggestion or ideas how we can do as a missionary work, being a teacher and pastors and the leader of our church?
Okay, thank you for that question. Yeah, sorry for sharing that advice, no, but then it will add new work to our leaders in the church, no, because I think now what we need to do is for our church to make simple trainings. Online trainings can be done just how we do this thing right now, where we do online trainings. Actually, this is a very great way, a great invention for all of us, and it forces us to conduct trainings without doing face-to-face interactions. And we can do simple trainings and to re-equip our our church members on the basic concepts of health. Ellen G. White has a lot of books on the basic concepts of health, and also providing simple skills, teaching simple procedures that these health our members can do at their homes and their societies, at their communities, and therefore by that small thing they can already help their communities as well. So I think the church needs to do um, capacity building for its members, and that's another work for our health directors and our health ministry department. But I think it's a way for us to move forward when it comes to this pandemic.
Thank you.
Thank you.
Hello, Doc. Just want a clarification because you mentioned a while ago that there was a meeting and there's no representative from Adventist. Anyway,
Yes.
just a report. Just a clarification. In the government side, being one of the worker there in the government institution, is there such thing as government's expectation from churches that the church can do, or just the government wait for whatever the church can do? Or, is there something that the government has expected something from the church?
No, actually, the government does not expect anything
Okay.
from any. Like it
But it
doesn't
will-
force the private sector to do anything. It doesn't force the churches to do anything. But then it's it would be very good if we'll help in serving the needs of the countrymen right now. When I talk of the forum that Seventh Day Adventists attended to, because the national government actually formed a technical working group to discuss mass gatherings in religious services and religious freedom as well during this time. I know they've conducted several meetings already, but on the first meeting, I haven't seen a Seventh Day Adventist representing the church, and it would be nice if the church was represented in that meeting or in the forthcoming meetings, because maybe our freedom, our liberties of worship will be discussed in those forums. And it is important for us to defend our religious freedom.
Okay, thank you very much.
Can I? Hello, good afternoon.
Good afternoon.
Yes, can I butt in?
Yes,
Well, as the government is not ready to or anticipated this kind of emergencies, so the church is. We never dreamt of this kind of emergency or crisis. The government has set up the National Disaster Risk Reduction and Management Committee from the national level to the local level. And there's so many community-based disaster risk reduction management at the community level.
yes,
But referring only to natural hazards
yes,
and not to any kind of pandemic, probably certain kind of health diseases or health related risks, but not to pandemic or epidemic of this proportion. But we also have experience, but the government and the church have not really grappled with or not utilized the 1918 pandemic. I saw your presentation on the 1918 pandemic, and there's so much to learn from that, how the church responded, how the government responded, and the cooperation between the two, and the acknowledgement of the government of the Seventh-day Adventist response in one city.
yes,
And because the Adventist was, though they were not expecting it, because it was just after a war, the World War II, or World War One, World War One. it was not, it was just after World War I. So it was very difficult. But even then, the church, or in that city, was able to respond well, using what Mr. Burillo was advocating, using the hydrotherapy, the 4 kinds of hydrotherapy, the steam inhalation, fomentation, contrast bath, and hot foot bath. They were using it widespread, and the government acknowledged it. But in our case today, I haven't seen an active promotion of the natural healing or natural therapy the church is engaged, which we were famous for. In fact, the sanitariums were built along that line, and it was never we're not leading as expected of the Seventh-day Adventist. We should be the lead and at the tail, and at the moment we have not seen yet. I'm not saying we will not, because now we're doing all these seminars, and so probably we'll do in the coming months. But you also mentioned about our individual responsibility. Our individual responsibility, because of our position in society. Sometimes we're also invited to speak, and we can also take this opportunity to speak in a broader society about what we believe, what we practice, and how to do it. And that's just my take. Anyway, thank you very much.
Yeah. Thank you, ma'am, for that. Yes, that's very true. Thank you for expounding more on the 1918 event. Yeah, that's very true that these procedures mentioned a while ago, the hydrotherapy, the steam inhalation, were the effective tools actually being spearheaded during that time by the Seventh-day Adventist Church, and was recognized by the government, the U.S. government, uh, during that time. And I believe so, if the Seventh-day Adventists will start to really take the lead when it comes to this in this implementation of these practices, then it would be nice to see the effectiveness of this, and for us to be able to share also the good news of salvation to these people during this pandemic. So that is why the health secretary during the time said that during the pandemic they had many opportunities only if they were trained very well. So I think now let's go to the drawing board again and look at how we can help. And that is always at first is that for us to train ourselves. I think that's the first step always, not to train ourselves, to capacitate ourselves, and then if we are trained and we have trained our church members, then we can go help the world and uh, uh, have a relevance. Our church having a relevance during this pandemic, and I hope really so to see more people taking more active roles when it comes to pandemic. I really want to see the Seventh-day Adventist Church stepping up. Um, Hopefully in the Philippines, we can step up and be a leading force when it comes to addressing this pandemic, because in the first place, the interventions here are just basically public health, and as a Seventh-day Adventist church, we have those knowledge, and the world and the country is looking for that knowledge to be shared to others.
Thank you, Dr. Keisha. And I'd like to acknowledge also our Dr. Lalaine. This is the last comment for you before we close. Okay, Dr. Lalaine, before I present the certificate, do you have any comment?
I'm sorry.
You have anything
Lecture
to say first?
after the lecture of Dr. Steven, I'll give an announcement.
Okay. So you please flash the certificate of appreciation.
Dr. Glenn? Hello?
The certificate of the certificate, is it there now? It was again. Okay, thank you very much for all your comments and your questions. And Dr. Kisha, thank you so much for giving us the insights on how the church could respond to situations like this. We believe that the church has to do more. And for those of us who are still thinking of doing more for the church, yes, going back to the basics of medical missionary work will enable us to visit homes and to be able to serve the community. So in behalf of the Southern Asia Pacific Division, Dr. Kisha Rosario, thank you very much. And we are presenting this certificate of appreciation for giving us the time that you have, because I know you're a very, very busy person, being now a national figure. Certificate of
Last
appreciation that we really
presentation
give
on the July.
because you have served the Lord in His territory in Southern Asia Pacific Division through the faithful exercise of your precious gifts of giving a lecture entitled Coronavirus Disease, the Impact and Role of the SDA Church During This Pandemic, to the participants of the health webinar entitled Scaling Up Comprehensive Health Ministry. And because of the body of Christ, this part of the world has been enriched by your faithfulness, we award the certificate of appreciation to you, Dr. Kisha Rosario, given the 16th day of June in the year of our Lord, 2020, signed Samuel So, President of Southern Asia Pacific Division, and Pastor Rudy Baloyo, the Executive Secretary, Sir Max Lani, the Treasurer, and Dr. Maria Rizalin Alfanoso, the Health Ministries Director. Thank you very much. And this certificate of appreciation will be sent to you through your email.
Yeah, it's okay. Thank you very much as well. It's my pleasure to have talked to
Thank
all
you,
of
Doc,
you.
and thank you to all those who have participated in our question and answer.
Thank you.
That's for Dr. Keisha. That's a token for Dr. Keisha.
Hi, thank you.
Okay.
Adventist Hospital.
Dr. Glenn?
Yes, let's continue.
Yes.
Okay, once again, good afternoon, everyone. We are coming to our last lecture this afternoon, and thank you for enabling everybody to be here with us in this Zoom meeting. And for those of you who are watching through Facebook, I hope that the connections in your place is stable. Now, our next guest speaker is a graduate of the Davao Medical School Foundation and has undergone his postgraduate internship and residency training at the Adventist Medical Center in Manila. He has attended trainings on mental health, effects of the COVID-19 pandemic, telephone and telemedicine in clinical medicine, and humanitarian response on conflict and disaster at the Harvard Medical School. He's an Associate Fellow of the Philippine Academy of Aesthetic and Age Management Medicine Incorporated, and a member of the Philippine College of Physicians and the Philippine College of Occupational Medicine. Presently, he is the Coronadal City Health Office City Health Physician, the Programmatic Management of Drug-Resistant Tuberculosis Program Physician, Head for Task Force Medical Incident Management Team at the COVID-19, a visiting consultant for Ala Valley Medical Specialist Center Incorporated and other private institutions, and a remote healthcare physician for International SOS previously served with the United Nations World Food Program. So we have a very impressive speaker this afternoon, and the topic, health protocols and guidelines in the new normal for workplaces, schools, and churches. Ladies and gentlemen, please welcome Dr. Stephen Mortera. Dr. Stephen, welcome to the Scaling Up Seminar for Comprehensive Health Ministry.
Just before he presents, he suddenly disappear because his internet connection is unstable. So he was just here
Okay.
a while ago. Then when I was about to put him on the spotlight, then he went off. So let's move on to maybe let's have a 2 minutes recess, and let's wait
Break.
for some.
Okay. Okay, sure. Okay, let's take a break for a while and have some water or take a short walk.
Greeting time, meet and greet.
Hello, everyone. Greetings time.
I would like to thank Lovely from South Philippine Union Conference for inviting us.
Praise the Lord,
Ma'am
ma'am.
Lovely Boscato.
We are also happy to see you, ma'am, and your team from Iligan.
Yes, thank you very much, and may God bless you. More power.
Thank you, ma'am.
We are very sad here in Iligan because one of our companion was not able to enter. She was nang saka? She was out. She was removed from the group.
Ate Arlene?
Yeah, si Ate Arlene, removed by the host.
Oh.
FB live na lang. Different.
She entered when the participants was still on 70.
Hello to all Adventist Medical Center Valencia workers. Dasig.
Oh, pwede na mo sulod, 96 na lang. Oh, sulay daw usab.
And Hingoog.
Kaway-kaway.
Dr. Glenn.
Yes.
Yeah, he's here. Doctors, are you around? Doc, naa ka na? Hello, Doc. I can see him, but he's not responding. He's saying he has a connection problem. Yeah, Doc, kindly show your face. Doc, hello. Doc, kayo na po.
Yes, Ma'am Lillian.
Doc, kayo na po. Go ahead.
Yes po.
Po? Oo, ako. Oo. Sige po. Magsalita muna po kayo.
Okay po.
Naka-off yung video mo.
Sige po.
Hindi ko po ma-share ang ano nyo. Hindi kayo makashare pag hindi po kayo nasa speaker's view. Show nyo na po yung face nyo, Doc. Kasi na-introduce na po kayo. We are waiting for you. Okay. Yes, Doc. Yes, yes. Everyone, that's Dr. Steven. Hello, Dr.
Hello,
Steven.
good afternoon.
Yeah, we already introduced.
Can you hear me?
Yes, Doc.
Yes, good afternoon. I'm just trying to decipher on how I'm going to share my screen with you guys. But can everyone hear me?
Yes.
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 You're loud and
Trying
clear.
to look for
You're loud
a way
and
that I will
clear.
be able to share my files.
Hindi ba kinukuha?
For a while.
जे लेक्चर कुछ ना
Zoom is another tool.
show that your camera is
I'm really sorry. I really cannot find the means and how I'm going to share my files. I can show my PowerPoint slides. So I'm trying to think, and then probably I'm going to send it over.
Okay, Doc. Your turn. Okay. Okay, I think his internet connection is not stable. So it's meet and greet time again for 3 minutes. You can talk to your friend and let's give 3 minutes to Dr. Steven first.
Hello everyone.
Hello.
Hello.
Rahul.
Hello, Lalaine.
Yes, this
and
is
everybody.
Rahul.
Hello.
Who's
I think.
Hi, Ate Zen.
Hello.
Pastor Robin.
right?
Hi. Good to see you.
Hi.
Good to see you too.
Ay, si Senny, kasi din the week.
I am working from home.
Yes, Andy and Rick.
Sir, hello, Pastor. How are you?
We've been on the webinar since this morning.
Oh,
Yeah.
very good.
Very good. We
We
also.
were as well, but we had trouble connecting.
Hi.
Hello po.
He's not turning the mic on. He's on the mute state. He unmute it.
I cannot hear.
Hi. We can
Hi,
hear
hello
you
po.
clearly. Your audio is very soft.
Can you hear me now?
Okay. We are from Pasig.
Yeah, the doctor is not. The speaker is muted, so he has to unmute it.
Your audio is so soft.
My audio soft.
Yeah. Yeah. So hi
Now
from
the Singapore-
Pasig. Hi from Pasig Church.
Can you hear me? Can you hear me?
Albert Core.
Albert Cor.
Yeah, I'm from Singapore.
From Singapore. Yeah.
Hi from Singapore.
This Dr. Stephen just now.
Yeah,
Onto
brother
the,
Albert.
onto the picture here. It is not his speaker. He's not
The speaker is
muted.
so soft.
You have to unmute the mic.
Yeah.
जी किसके साथ You're going? मुझे पता ही नहीं इसलिए What do you want to eat?
शीजा
And drink?
शीजा अपना माइक अनम्यूट करो
Pastor Jimmy. Hi. How's Indonesia, Pastor?
It's good.
Oh.
How about you there, lovely?
The COVID cases are still rising, but we're back at work. We have to work.
The COVID cases in Indonesia still grow.
Yeah, same here in the Philippines.
Yeah, that's why. Okay. How about your evangelistic meeting? Still there?
Yeah, we just finished the AWR evangelistic effort by
Okay.
yeah.
It's good.
And
जो नहीं थे ना अभी कुछ
the series of Pastor Gulpan has just finished.
Okay. I follow it because you invite me 2 times maybe.
Sige. Thank you to Ma'am Apple.
I praise the Lord, Ma'am.
Yeah.
Welcome, Ma'am, dinhi.
Yeah, yami diri, Ma'am Nidi Hangalay, Ma'am Yen Nases.
Grabe, dasig kayo sa pag-alaga.
Dasig, igsoon.
Dasig kayo pa sila.
Panimbaya
Murag
sa
kamurag
ta
yun
diri.
nakalusot.
Lagi kay nagkuan man daw sila dito tapos pan daw.
Big screen.
Nagchika na ni.
Grabe, ah.
Na si Ma'am Nede, oh.
Ma'am Nedi. Uy, nag-usang magbalay, te.
Ah? Thank you.
We're in the same house.
Oh, that's why.
As
Dancing
of today, just for
today.
the Zoom meeting.
and also Ma'am Elindu, Nasi.
Yes.
From Bayog, Ma'am Ilinlo, traveling early in the morning.
Your internet connection is good.
Yeah.
Asa mo dapit karon, ma'am? Batu or Bayog or
Here in Ipil.
Ipil. Okay.
Wala man kani sila.
It's all Tagalog, cannot understand.
Let's speak in English. Oh, the president of Adventist Hospital Davao wants to join, sir.
Yeah.
Jo
I know
Pialago.
him.
Yeah.
Sir Marijo Pialago, where is he?
Yeah, he wants to join, but he cannot join. He cannot
Why?
enter. I think the participants already reached 100.
Yeah,
No, I saw the participants is
that's a very
about
sad
96
thing.
only.
Yeah.
You can join with Facebook, I think.
Hello, it is very difficult to get exam departments. I am from Bangladesh, but morning I have been trying to tell.
Hello, Adventist Hospital Davao.
Please tell him that if he wants to join, I can give my I can give my place to him. I can leave the meeting, then he can join.
Is this Ma'am
Gentlemen?
Yes.
You can access our webinar on our Facebook page. Even though they're not part of the Zoom conference inside, they can still access it in our Facebook page.
Yeah, that's true.
Yeah. I already shared the link to them, ma'am.
Okay.
Thank you.
And don't worry, it's just for today. For tomorrow, we will have a new code, and it can accommodate up until 500.
Wow, yay. Okay, we'll remind
Praise the Lord.
Thank you. Praise the Lord.
Mute na.
Thank you, Ma'am Apple, for inviting us.
You're welcome, ma'am. This is the Lord's work, and we have to occupy our time during the pandemic.
Thank you for facilitating us.
Just stay positive, not with COVID.
Is the seminar over or it's just?
The conference is not yet over, ma'am. We are still waiting for Dr. Steven to get online because he is experiencing unstable internet connection. So kindly wait for a while, and we will wait for Ma'am Lalane's queue.
All right.
Hello. Maka-story ko diri na. Hello. Hello, everyone.
Hi, Tibet.
Hello.
Dami sa London Bridge.
Ma'am Wilma Labad, thank you for joining. And Hingoog Sanitarium and Hospital.
Hello, Doc Lenny Pialago from Adventist Hospital. Ha.
Ma'am Seniza, thank you so much, ma'am, for joining.
Thank you, Ching. Thank you sa gwapa na comment.
Mrs. Kaderma, the wife of the STUC president, thank you for joining.
Yes, Paul.
And-
Present ko dari sa call.
And Dr. Jeannie Generato. Thank you so much, Doc.
Hi.
Hello, Ma'am Apple.
Yes, ma'am.
Sir Pialago was able to join.
Right now, they're watching via Facebook live stream, ma'am, but I told him already that they can be accommodated tomorrow.
Okay.
Yeah. They're watching.
Is our
as a
speaker
group.
online?
I think not yet.
Not yet.
Not yet, I think, Pastor.
Sorry.
Ma'am Perry. Ma'am Perry Jean
Hi, Sergio.
Bernabe.
Sergio.
Per.
Okay.
Facebook Live.
What if there are like two speakers ready? If somehow one's connection is not stable, maybe we can accommodate the other one. Or during this time, there could be a choir singing, something more missionary type.
Hello, you said that you will issue a certificate. How can a member can receive a certificate?
Hello, Adventist Hospital, Bacolod, Davao.
Off the cake. Ano na? Matapos na.
Nakita lang taan eh. Pops!
Regards kay Ma'am Beth, yan.
Regards sa gwapa nga
Regards kay Ma'am Beth.
nga naka-aircon.
Naka-aircon.
Ma'am Beth. Regards.
Hi, Sergio, Doc Lenny.
Kapo kay blouse tanaw ang ilalom ang naka-shorts.
Kuya dia ulaw kaayo.
Dito sa hospital, diba? Si Sodan. Just sa hospital.
Kasi siya kayo sa San Francisco.
Adventist Hospital, Davao.
Adventist Hospital, Davao. Hello.
Hello.
Sergio. Doc Lenny.
Sergio, Doc Lenny. Hello.
Where is Sergio Pialago? Sergio Pialago, where are you? Where are you now? Ma'am Nidi, how are you, Ma'am Nidi? Are you planning to go back tomorrow? Or just have live on Facebook? You are supposed to join in the not in the,
Ate Wilma. Ate Wilma is turning on
Hello,
her
Ned.
microphone. Hello, Ate Wilma Laba.
Hello, Ma'am. Ma'am Vergara.
hello,
Mga beautiful kayo mo.
how are you? We
I'm
meet
all
you
right.
here. Wala ko ka Zoom, nagwas lang ko. Si Jojo Pilago katong presidente sa kuan. Hala. Kinsa? Hello, don't worry, Sergio Pilago. Tomorrow you'll be accommodated. Ma'am Apple said.
Co-host.
Ma'am Apple. Sir Pialago said, wala ko ka Zoom. Nagwas lang ko sa inyo. Ma'am Apple. I wanna leave my ano.
Okay na po, Doc. Doc, nag-zap na kita.
Hello, can you hear me? Hello? Hello, I'm Alvin from Singapore. Hello?
Yes, we can hear you, Pastor. Yes, Pastor.
Yeah, while we're waiting, can I say something about Singapore?
Yes.
Tell us
Hello?
more about Singapore, Pastor.
Okay, I'm not pastor.
Ah, okay, sorry. Okay.
I used to work in Youngberg Hospital for 30 years. Now
Wow.
I'm retired. And share with you something about Singapore. Singapore, though they have the highest of COVID-19 positive, and most of these tested are from the foreign workers' dormitories.
Oh.
And the amount of now it's about 40,000 altogether. However, the government report the community, that means the Singaporean, the PR, those are not in the staying in the dormitory, and they have tested the local one has reduced to 1 digit. That means single digit. Therefore, it will be so much better. And now by this coming Friday, the government is open up more business and release the restriction. And normally we're not supposed to go out unnecessarily. Whenever you go to buy food, it's very strictly ordered. You don't anyhow rush to a supermarket, and each supermarket has a control number according to your identity card number. And there's entries to the shopping, to all this, especially you buy food. You're not supposed to eat there. You have to buy a pack and go home. Similarly to the market. And because the government control that well, we have bring down the infection much lower to single digit. Now what the churches, our churches here in Singapore do is they organize and cook the food for those on the front line.
Excellent.
They supply the food to
Mhm.
the front line, and also supply to those aged persons, seniors, so forth, where they could not able to come out to buy food.
Mhm.
And in Singapore, I've understand in my church, the community church, of which there are some nurses, Filipino nurses, working on the front line.